When we hear about hormone replacement therapy, or HRT as it's known, it can sound like everything boils down to a couple of magic pills or a few patches that fix your life. But, as is often the case, the reality is much more complex and honestly much more interesting. And if you stick with me until the end, you'll discover options that almost nobody talks about, and nuances that could make the difference between giving up or finding something that truly works for you. Most women start hearing about HRT in their 40s, when hot flushes, mood swings and sleepless nights become impossible to ignore. That's when the big question pops up. Should I take hormones? And of course, opinions come flying. Some say it'll give you cancer, others that you'll feel 20 years younger, and some claim it's a one-way ticket to hell. And in all that noise, what really matters gets lost: the individuality of every body, every story, every stage. The first thing they almost never tell you is that there are countless types of hormone therapy. It's not just a simple yes or no to estrogen. It's not a one-size-fits-all approach. There's bioidentical estrogen, synthetic estrogen, combined therapies, treatments that are oral, others that are transdermal, like patches or gels, subcutaneous implants, and even more specific options like vaginal rings or local creams. Each of these choices not only feels different but acts differently in your body, and depending on your medical history, your symptoms, and your lifestyle, one option might be far better suited for you than another. One major difference that few people discuss is the method of administration. When you take estrogen orally, your liver metabolizes it, which can affect your triglyceride levels, blood clotting, and other processes. But if you use a patch or a gel, the estrogen goes directly into your bloodstream without passing through the liver, which can be a safer option for some women, especially if they have a history of thrombosis or cardiovascular risk factors. Another crucial detail often overlooked is the type of progesterone used alongside the estrogen. If you still have a uterus, you need progesterone to protect its lining and reduce the risk of endometrial cancer. But not all progesterones are the same. Many traditional therapies use synthetic progestins, which are molecules similar to, but not identical to natural progesterone. And in some studies, they've shown more side effects, such as mood swings, bloating, or breast tenderness. In contrast, micronized bioidentical progesterone, which is chemically identical to the hormone your body produces, tends to be better tolerated and has a more favorable safety profile. However, it's rarely offered up front unless you specifically ask for it or insist on it. And here's something even less discussed: personalized dosing. Many women are given a standard dose, without anyone bothering to adjust it based on their symptoms, response, or blood tests. But HRT, when handled optimally, should be a tailor-made suit. Because not all of us need the same amount of estrogen or progesterone. Not all of us metabolize hormones in the same way. Not all of us experience the phases of menopause in the same manner. And tweaking those tiny amounts can make the difference between feeling like yourself again or dragging yourself through side effects that make you want to give up. Another dimension rarely explored is the role of testosterone in women's health. Yes, you heard that right, testosterone. It's not just a male thing. In fact, women produce small amounts of testosterone, and this hormone has a huge impact on energy, libido, muscle mass, mood, and even memory. During perimenopause and menopause, our testosterone levels also drop, and for some women, restoring small doses of testosterone can be the game changer between feeling flat or regaining vitality. And this brings us into a fascinating area: the use of compounded therapies from specialist pharmacies. Instead of using off-the-shelf commercial products with fixed doses, some women work with specialist doctors who create customized formulas at trusted pharmacies. This way, they can adjust the exact amount of estrogen, progesterone, and even testosterone they need in the format they tolerate best. Of course, this approach requires closer monitoring, more tests, and more dialogue with qualified professionals. But for many women, Especially those who've tried conventional treatments without success, it can be a real lifeline. Now, I want to touch on something that almost no one dares to mention: the psychological impact of starting, or not starting, hormone therapy. Because beyond the physical changes, there's a massive emotional load. Feeling normal, desirable, sane shouldn't be a luxury or a taboo. Yet many women carry a silent guilt if they choose to take hormones, as if they're betraying some supposed natural purity or irresponsibly risking their health. And just as many feel shame if they prefer not to take them, as if they're giving up or letting themselves go. The truth is that no option is morally superior. What matters is that the decision is conscious, informed, and truly yours. And if you thought all this was complicated, wait, because there's another factor that changes the rules of the game: timing. When you start HRT can significantly affect its benefits and risks. Experts talk about the window of opportunity. The first few years after menopause are a golden time to begin therapy, because during this period, the benefits for bone, heart, and brain health seem greater, and the risks lower. But, of course, every case is unique, which is why having accurate information and quality medical support is absolutely vital. Another massive myth we need to bust is that HRT is only for hot flushes. In reality, its scope is much broader. Hormone therapy can help preserve bone mass and reduce the risk of osteoporosis, improve cardiovascular health, protect skin elasticity, enhance cognitive function, and even lower the risk of type 2 diabetes. It's not a magic wand, but it's also not the devil it's sometimes made out to be. As always, nuance is king. And before you start thinking that it all depends on finding the perfect doctor, let me tell you something that perhaps no one has said before. You are your best advocate. Learning about your body, your options, and the right questions to ask during consultations can change everything. You don't have to be an expert, but you can be an active participant in your journey, rather than a passive spectator who just accepts whatever is said. You might now be thinking, all right, but what if I can't or don't want to use hormone therapy? And believe me, that's a crucial question. Because although today we're focusing on HRT, there's also an entire world of complementary alternatives and integrative approaches that can help you move through this stage of life with more ease, more power, and above all, more authenticity. Before we continue, something important: in the description of this video, I've left a resource that could really help you through this stage. It's something several women are starting to use and are seeing real changes. If you're curious, have a look later. It might be just what you need. When we talk about alternative or complementary options, we're not just referring to herbal teas or supplements that promise the world. There are far more serious science-backed strategies that can play a huge role, whether you choose to use HRT or not. And you'd be surprised to know how many of them aren't even mentioned during an average medical consultation. One of the most intriguing is nutritional optimization, specifically for menopause. Beyond eating healthy in general terms, there are nutrients that have a direct impact on hormone levels, inflammation, bone health, and metabolism. For instance, magnesium doesn't just help you sleep better and relax your muscles. It's also involved in hormone production and insulin sensitivity. Zinc plays a crucial role in progesterone production. And natural phytoestrogens found in foods like flax seeds, tofu, and legumes can have a modulating effect on estrogen receptors, easing some symptoms without the need for synthetic hormones. Another approach that's rarely explored in depth is exercise adapted to the hormonal stage. Not just any routine will do. During menopause, the loss of muscle mass and changes in fat distribution mean that strength training becomes not just advisable, but almost essential. Lifting weights, resistance exercises, and balance work not only strengthen bones and muscles, but also have a positive impact on hormone regulation, mental health, and overall metabolism. But of course, it must be adapted to your level, your mood, and your daily energy, without forcing yourself without guilt, and without ridiculous comparisons. Speaking of maintaining internal balance, we can't leave out stress management. Cortisol, the well-known stress hormone, plays a devastating role when chronically elevated. It can sabotage your efforts to maintain a healthy weight, worsen hot flushes, disrupt your sleep, and even interfere with any hormonal treatment you might be using. Techniques like mindful breathing, meditation, gentle yoga, or even outdoor walks might seem simple at first glance, but their cumulative impact can be tremendous. And no, you don't have to become a Tibetan monk for it to work. Small moments of daily reconnection are enough. Now then, let's return to the topic of HRT and touch on an issue that causes a lot of confusion: how long it's safe to use hormone therapy. It used to be said that 5 years was the maximum. Then studies emerged that questioned that rule. Today we know there's no rigid limit that applies to everyone. It depends on many factors: your age when you start, your overall health, the type of hormones you use, the dose, and the method of administration. Some women can benefit from using HRT for a longer period under proper medical supervision. The goal isn't to keep taking hormones just for the sake of it, but because you're still gaining clear benefits that outweigh any potential risks. Every medical checkup is an opportunity to reassess that balance. Another delicate but crucial matter is understanding what happens when you stop hormone therapy. Many women fear coming off HRT because they think everything will spiral into chaos. The reality is that some women do experience a return of symptoms like hot flushes or insomnia, while others notice no change at all. Sometimes gradually reducing the dose can make the transition smoother. Other times, staying on low doses for longer is the better choice. It all depends on how your body responds and what your quality of life priorities are. And now, something very few will tell you. Hormone therapy can also have effects in areas you might not have linked to menopause. For example, it can improve dry eyes, often simply attributed to aging. It can have positive effects on the elasticity of gum tissues, indirectly supporting dental health. It can even influence how your skin responds to minor wounds or infections. Estrogen deficiency impacts almost every system in the body, and replacing it, when appropriate, can have much broader benefits than we usually imagine. But it would be irresponsible to talk only about the benefits. It's equally important to be very clear about the risks. There are potential risks associated with HRT, particularly when certain types of estrogens or progestins are used, especially in women with specific risk factors. The risk of blood clots, strokes, breast cancer, and cardiovascular disease exists. It's not massive for everyone, but it's there. That's why the approach must be personalized, evidence-based, and regularly reviewed. One less discussed but important topic is the link between HRT and neurodegenerative diseases like Alzheimer's. Some studies suggest that starting hormone therapy during the window of opportunity could have a protective effect on brain function in the long term. However, starting HRT many years after menopause may not offer that benefit and could even be counterproductive. Once again, timing and context matter enormously. And if you're wondering, why aren't we told all this during regular consultations? The answer is uncomfortable. Many times, doctors simply don't have the time to go into depth with each patient. Other times, their training on women's hormonal health has been minimal, and in some cases, public health policies prioritize more conservative approaches to avoid litigation or costs. That's why it's so valuable that you're here, informing yourself, empowering yourself, preparing to have those difficult but necessary conversations at your next medical appointment. Before we close, I want to leave you with a reflection. Menopause is not an illness, it's not a defect, it's a transition. Like all great life transitions, it can be uncomfortable, challenging, even frightening. But it can also be an opportunity to be reborn in your own body with a deeper awareness of your needs, your limits, and your desires. Hormone replacement therapy isn't the only answer, but for many women, it's a valuable, sometimes essential tool. Knowing that you have options, that you can personalize, adjust, and change your mind if needed, is an act of self-love. There is no universally right path. There is the right path for you, and it starts with knowledge, curiosity, and the courage to ask the right questions. So if this video has sparked new questions, new ideas, or simply made you feel accompanied on this complex journey, I invite you to keep exploring. Because the true power of navigating menopause lies not in resisting nor in resigning. It lies in choosing every day with all the information and all the courage you deserve.